And now we have Dr. Unni Karunakara, former international president and senior fellow at Yale's University Institute for Global Health. So I would like to ask you, is enough being done to protect the most at the risk in our society in India?
First of all, thank you for asking me to join you all today. And I just want to start with making a correction that we are not just doctors beyond borders, we are doctors without borders. An important distinction, I would say. Yes, vulnerability and there are large numbers of people who are at risk, higher risk than usual for COVID. In India, for example, the lockdown happened perhaps at the right time, but I think a lot of workers who wanted to return home, their return could have been managed better. So we now have a situation where we have large numbers of people moving from big metropolitan areas to states like Bihar and other states. So their situation is of concern to us, and we are paying particular attention in Patna and in Mumbai, etc. But in addition to that, there are we have large numbers of patients on tuberculosis treatment. And because of the situation and because of capacity issues in hospitals, etc., it has been a challenge to continue treatment to a lot of the people who have chronic conditions.
But Dr. Karunakara, let me ask you this. Based on the essential humanitarian values of Médecins Sans Frontières, what are some of the steps being taken to help those most at risk? For example, returning workers to their home states.
Yes, so in Patna we have started treatment facilities in Patna. Testing, of course, is going on, but our efforts are to supplement the efforts of the state and meet the needs of people who are returning from Delhi and other places, right? So, but I'm also talking about all of the supplementary efforts that we need all of the other healthcare needs met as well. So, patients on MDR TB treatment, for example, and it's interrupting their treatment is a big problem if we do. In outside India, for example, just the simple vaccination programs in countries like Congo, etc., are being disrupted. So they may not be a problem at the moment, but they will soon be a problem if they're not able to do basic vaccination, provide basic TB care. If we're not able to provide, we have high rates of domestic violence. We have opened a mental health hotline in India. So these are all very important activities that we feel should accompany COVID testing treatment in wherever we work, and especially in India as well.
Yes, doctor, there are a few other challenges, like what can be done to combat stigmatization of medical care workers as well as patients?
Yes, that is, so we are spending a lot of energy worldwide combating misinformation. There's a lot of fear around, as always, historically that's always been the case. There's a lot of fear and panic around a pandemic. There's a lot of misinformation. So one of the things that we do is education campaigns and providing the right sort of information. Stigma, among other things, it's not just bad for the patients, but it's also affecting health workers in a big way. Since in the past few months, there have been at least close to 300 recorded attacks against healthcare workers internationally. This is in addition to the normal violence that health workers face in many countries around the world. So these are issues of serious concern. In India itself, we know that health workers, doctors, nurses are asked to leave their homes. They're not accorded proper burial in some cases. So these are all issues of great concern. If health workers are not protected, whether it is protection material, but also legally, the police protection, etc., it is very important to preserve the capacity for us to be able to provide care for
Absolutely,
COVID.
Doctor.
in other countries,
Yeah.
in other countries, we have real problems because doctors are also the first ones to be affected, and they also get infected, and mortality rates have been high in some
Absolutely. We
countries.
also lost a doctor in Delhi today from LNJP. Thank you so much, sir.